Good afternoon. My name is Monica. Today I'm going to discuss about Unit 4 journal assignment. During my rotation with the mental health rotation this week, I meet with 16 years old patient with PTSD whose presentation made me strong impression on me. The patient has difficulty discussing the traumatic event directly and become visibly guarded when contain a topic were mentioned, but the interaction show me how important safety and pacing and trust are in adolescent trauma care. This experience deepened my understanding of PACE and PRO psychiatric mental health nurse practitioner role because I saw that assessment, treatment planning, and therapeutic relationship must all be trauma informed. This encounter helped me to see that a psychiatric nurse practitioner does much more than identifying symptoms and assigning a diagnosis. In adolescents uh, post-traumatic stress disorder, the provider must balance a careful assessment with emotional sensitivity because asking too quickly or too directly can shut down the communication and increase distress. I learned that psychiatric nurse practitioner role include helping the adolescents feel safe enough to participate in care while also recognizing the symptoms such as avoidance, hyperarousal, intrusive memories, and emotional numbing. That combination of clinical skill and relational skill is center of effective trauma treatment. In this In this case, my understanding of PTSD psychopathology in adolescents, especially how trauma can affect communication, emotional regulation, and engagement. The patient's guardedness did not feel like resistance in a simple sense. It feels like a protective response shaped by the fear and prior stress. I better understood that trauma symptoms are often expressed through behavior with the withdrawal or difficult trusting adult, not just through the verbal report of distress. This reinforced that the provider patient relationship is not separate from the treatment in the trauma care, it is a part of treatment itself. One of my strengths in this interaction was patience. I was able to show my pace, remain calm, and avoid pushing the patient to share more than they were ready to discuss. I also think I show empathy and respect, which helps the patient feel less judged. A limitation I noticed was my discomfort with silence and uncertainty because I want to gather the full story quickly, even through trauma informed care require allowing the patient to control the pace. If I had a rush if I had a rushed the conversation, I might have weakened the trust and reduced the patient willingness to continue opening. I experience the help me to reflect on my therapeutic use of self in deep way. I realized that with traumatized adolescents, my tone, facial expression, body language, patience are all part of the intervention. I intentionally use gentle tone, reflective listening, open-ended question to communicate safely and respected. I also become more aware that self-regulation is necessary because the provider's calm presence can help to create the emotional stability that trauma affected adolescents may not feel internally. Most specific things that I learned was that in PTSD care, safety before detail is essential. I learned that it is important therapeutic to first build the trust and provide emotional containment, then to focus immediately on the trauma event itself. In further practice, I will apply this by using trauma informed communication, explaining what to expect before asking sensitive questions, and allowing adolescents more control over how much they share and when they share it. I will also continue to use grounding grounding patients validation as a part of clinical approach, because those strategies support engagement and help protect the provider patient relationship. This experience was very wonderful and it helped me to be grounded on patient care. I will look forward to use this practice in future as well. Thank you so much.